Hi, my name is Ixchel Velasco and I'm going to talk about randomized trial of lactin-V to prevent recurrence of bacterial vaginosis. Here, I leave you my social media so you can follow me. Content, definition, application, pros and cons, issue in Ecuador and conclusion. Definition. Bacterial vaginosis is a type of vaginal inflammation caused by the overgrowth of bacteria, found naturally in the vagina, upsetting the natural balance. Application in medicine. Lactobacillus crispatus is a type of lactobacillus. The CTV05 strain is used as a probiotic that can be used by premenopausal women and postmenopausal women who experience recurrent urinary tract infections. It is being specifically evaluated for the prevention and treatment of bacterial vaginosis, which is characterized by the absence of Lactobacillus flora, also known as Lactobacillus acidophilus. It plays an important role in protecting the host against infection. Pros and cons. Recurrent bacterial vaginosis leads to negative emotional, sexual, and social effects, as well as a substantial financial burden on the health system. The use of lactin-V after vaginal metronidazole treatment for bacterial vaginosis results in a significantly lower incidence of recurrence of bacterial vaginosis at 12 weeks than placebo, and the benefit appears to persist until week 24. The most common request local adverse events were abnormal vaginal discharge, abnormal vaginal odor, external genital irritation, and genital itching, and the most common request systemic adverse events were abdominal pain or cramps, headache, and frequent urination. Issue in Ecuador. According to studies from the Pontifical Catholic University of Ecuador, the prevalence of bacterial vaginosis was 28%. 10.3% of a study population have several sexual partners. Conclusion. Bacterial vaginosis affects 15 to 50% of women of reproductive age, and recurrence is common after treatment with an antibiotic. The high incidence of recurrence suggests the need for new treatments to prevent recurrent bacterial vaginosis, so lactin-V is a good option. Now you can see some videos about this topic.
Just very quickly here, with a minute to go, Jenny says, how do I get rid of bacterial vaginosis? She's had it on and off for 2 years. Treatment usually clears up, but then it comes back.
So bacterial vaginosis is as a result of a change in pH or disruption of the chemicals within the vagina. So it can cause this fishy, really sticky kind of discharge. Now, the main way of treating it is antibiotics. But if it's happening recurrently, which it often does with a lot of patients, 50% of people get it again within 3 months, then they may need either a prophylactic thing, so something to stop it from recurring, or looking into whether they've got any triggers like soaps, bubbles, vaginal douching, any of those kind of things that might be the cause. If it happens despite all of those things, you can be referred to a gum clinic, so a genitourinary
I've never heard of that either. I'm learning lots today.
So,
what does it stand for?
Genitourinary medicine clinic.
And
gum.
so they'll check and
they
then...
can check it all out and make sure everything's okay down below.
OK, but you shouldn't have to put up with it. Great.
Bacterial vaginosis is the most common vaginal infection women get through the ages of 15 to 44. It's an imbalance of good and bad bacteria in your vagina. Symptoms include vaginal irritation, sometimes odor, change of discharge, and sometimes vaginal burning. Bacterial vaginosis is diagnosed with a vaginal swab done in the office. Treatment includes pills or gels. Unfortunately, there isn't any over-the-counter treatment currently for bacterial vaginosis.
Hi, I'm Lauren with the Flex Company.
And I'm Dr. Jane Vandis, medical advisor to the Flex Company.
And I'll be answering some of the most frequently asked questions from some of our customers.
Flex is wonderful for women who suffer from recurrent bacterial vaginosis, BV, or recurrent yeast infections. The vagina has a natural pH between 4 and 5 on the pH scale. And when a woman is menstruating, the pH of the blood that is being sloughed off from the lining of the uterus can actually affect the pH of the vagina because the pH of the blood is more alkaline. The tampon is soaking up the blood and it's sitting and filling up the vaginal cavity, in this way exposing all of the vaginal walls to that increased pH, which we know can affect the growth of bacteria in the vagina as well as yeast. Flex is an inert plastic and it's not going to interfere with the biological composition or the flora of the vagina. So in this way, Flex actually can really help women who suffer from these types of recurrent infections that can occur in association with their period.
Many of the patients come in complaining of recurrent infection, vaginal infections, yeast infections, even urinary tract infections. And this can partly be because of the pH changes that happens with normal aging or after menopause. The V-Confidence procedure can help create healthier tissues, can bring the glands in that area to a healthier, younger state and restore normal pH, and that can do a lot in minimizing recurrent infections. The great news is that most patients will see improvement after their first V-Confidence procedure and are very excited. We're really, giving women, empowering women to take control of their sexual health, take control of their sexual life, live life to the fullest, no matter how old they are, no matter how young they are. It can be better.
You mentioned that you have bacterial vaginosis, also known as BV, and you recently found out you're pregnant, and you're wondering if that may affect the pregnancy at all. And generally speaking, symptomatic vaginal infections should be treated in a timely manner at any time, but especially during pregnancy, because there is some research to suggest that bacterial vaginosis can put a woman at greater risk for preterm delivery. So talk with your doctor about it, and they'll determine if treatment is warranted. A good rule of thumb in general is just to talk with your doctor if you notice a change in the color, odor, or consistency of discharge, because those can be signs of infection. So after asking more specific questions and performing an exam, the doctor can give tailored information and advice. If you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com.
Thanks for watching.